A 6-year-old is admitted with QA client is admitted to the acute care unit. Initial laboratory values reveal serum sodium of 170 mcl. What behavior changes would be most common for this client? A. Anger. B. Mania. C. Depression. D. Psychosis. Rationale: the client with serum sodium of 170 mcl has hypernatremia and might exhibit manic behavior. Answers A, C, and D are not associated with hypernatremia and are, therefore, incorrect. Q. Which action by the healthcare worker indicates a need for further teaching? A. The nursing assistant wears gloves while giving the client a bath. B. The nurse wears goggles while drawing blood from the client. C. The doctor washes his hands before examining the client. D. The nurse wears gloves to take the client's vital signs. Rationale: it is not necessary to wear gloves to take the vital signs of the client under normal circumstances. If the client has active infection with methicillin-resistant Staphylococcus aureus, gloves should be worn. The other answer choices indicate knowledge of infection control by the actions, so answers A, B, and C are incorrect. QA 6-year-old is admitted with suspected rheumatic fever. Which finding is associated with rheumatic fever? A history of low birth weight. B. A case of strep throat several weeks ago. C. Presence of sickle cell trait. D. Inability to digest certain grains. Rationale: rheumatic fever is associated with a history of a sequela to strep throat. Answers A, C, and D are not associated with rheumatic fever, therefore, they are incorrect. QA client recovering from a thyroidectomy tells the nurse, "I feel numbness and my face is twitching." What is the nurse's best initial action? A. Offer mouth care. B. Loosen the neck dressing. C. Notify the physician. D. Document the finding as the only action. Rationale: the parathyroid gland can be inadvertently removed or injured with thyroid removal. This can cause hypocalcemia and symptoms of tetany, which requires notifying the physician. Answers A and B are ineffective ways to treat or obtain treatment for hypocalcemia. Answer D would allow the condition to progress, so it is incorrect. Q. Cataracts result in opacity of the crystalline lens. Which of the following best explains the functions of the lens? A. The lens controls stimulation of the retina. B. The lens orchestrates eye movement. C. The lens focuses light rays on the retina. D. The lens magnifies small objects. Rationale: the lens allows light to pass through the pupil and focus light on the retina. The lens does not stimulate the retina. Answer A, assist with eye movement. Answer B, or magnify small objects. Answer D. Q. The physician has instructed the client with gout to avoid protein sources of purine. Which protein source is high in purine? A. Dried beans. B. Nuts. C. Cheese. D. Eggs. Rationale: foods high in purine include dried beans, peas, spinach, oatmeal, poultry, fish, liver, lobster, and oysters. Answers B, C, and D are incorrect because they are low in purine. Other sources low in purine include most vegetables, milk, and gelatin. Q. The primary difference between practical nursing licensure and a nursing certification in an area of practice is that nursing licensure is A. ensures competency and a nursing certification validates years of experience. B. mandated by the American Nurses Association and a nursing certification are not. Cyrillic letter S. is legally mandated by the states and a nursing certification is not. D. renewed every 2 years and a nursing certification is renewed every 5 years. Rationale: the primary difference between practical nursing licensure and a nursing certification in an area of practice is that nursing licensure is legally mandated by the states and not the American Nurses Association, and a nursing certification is not mandated. To practice nursing without a current and valid license is contrary to the law. Nursing licenses are renewed every 2 years and nursing certifications are typically renewed every 3 years. However, this may vary according to the particular certification. Passing the NCLEX examination and receiving a nursing license indicates that the graduate has at least the minimal competency necessary to provide safe patient care. Nursing certifications, on the other hand, validate expertise in a particular area of nursing practice. QA client with Addison's disease has a diagnosis of fluid volume deficit related to inadequate adrenal hormone secretion. Which fluids are most appropriate for the client with Addison's disease? A. Milk and diet soda. B. Water and tea. C. B. Oil and juice. D. Coffee and juice. Rationale: the client with Addison's disease needs an increased sodium intake. Bouillon and juices such as tomato juice are high in sodium. Answers A, B, and D are incorrect because they do not contain high levels of sodium. Q. The nurse is caring for an 8-year-old following a routine tonsillectomy. Which findings should be reported immediately? A. Reluctance to swallow. B. Drooling of blood, tinged saliva. C. An axillary temperature of 99 degrees Fahrenheit. D. Respiratory stridor. Rationale: respiratory stridor is a symptom of partial airway obstruction. Answers A, B, and C are expected with a tonsillectomy. Therefore, they are incorrect. Q. The nurse is planning dietary changes for a client following an episode of pancreatitis. Which diet is suitable for the client? Low calorie, low carbohydrate. B. High calorie, low fat. C. High protein, high fat. D. Low protein, high carbohydrate. Rationale: the client recovering from pancreatitis needs a diet that is high in calories and low in fat. Answers A, C, and D are incorrect because they can increase the client's discomfort. QA client is admitted to the acute